Hi, everyone. My name is Jess Nicholas, and I'm here with another installment in our dental interview series. I'm here today with Dr. Stephen Brown in Philadelphia and Dr. Mark McCawley in Fort Lauderdale, Florida, and they're both periodontists. Today, we're going to be talking about dental implants. It's a great procedure for people with missing teeth, and it can restore a lot of quality of life for a lot of people. So these two gentlemen are experts in the field. They have tons of experience in this procedure. So we're very excited to get their opinions and their experience and hear what they have to say. So without further ado, we will get going here. Dr. Brown, the first question is for you, and it is, please briefly describe dental implants and when they're typically recommended for patients.
Well, we recommend dental implants to patients virtually anytime someone has a missing tooth, assuming that they are healthy in their mouth, they don't have periodontal disease, they've got quality, quantity, and volume of available bone. Most patients can receive dental implants, and they are a remarkably good way to replace a missing tooth.
Okay, great. Dr. McCawley, kind of what is a dental implant and how are they used specifically?
I mean, how it's used is the important part because it replaces teeth. You say you've got missing teeth, it would be a tooth replacement. And that's kind of the most important part. What the actual dental implant is, it's actually a titanium post that goes inside your bone. It's implanted into the bone. That's why they call it an implant. So that's the part that goes into the bone and it simulates a tooth root. So kind of how the teeth have a crown on top and a root on the bottom, an implant's a similar kind of thing, where you've actually got the implant on the bottom and you still have to build a crown on top. And that's the part that you see, that's the part that you chew with. But that's kind of, in a nutshell, what a dental implant is there.
Okay, very interesting. Dr. Brown, who is a good candidate for dental implants?
Well, as I mentioned before, if a patient's mouth is healthy from a periodontal standpoint and they don't have other overriding disease things in their mouth, most patients are good candidates. The thing that we need is, as I said, quality, quantity, and volume of available jawbone. And most people have that. And if they do, it's, as Mark mentioned, it is a very simple, non-invasive procedure. People have virtually no discomfort. And the reason for that is that there are actually no nerves in bone. So consequently, if we make a little penetration into the bone in order to receive an implant, there's virtually no discomfort.
Okay, wow, that's great. So Dr. McCawley, if someone did have gum disease, what would you have to do in that situation?
Well, if they do have gum disease, like what Dr. Brown said, it does increase your risk of implant failure. So it's very important to treat the gum disease prior to or at the same time you're placing that implant. That way you can make sure there's no infection, there's nothing like that can possibly compromise the outcome of that implant. So what we actually do is we treat that gum disease. A lot of times we'll end up using laser. We use an IndiYag laser to do the laser-assisted new attachment procedure. And what that does is it disinfects the mouth. It makes it so instead of, placing an implant next to a tooth that's clearly got some gum disease, some gum infection, where, that's going to greatly increase your risk of implant infection. We can disinfect it and then we can place that implant. And then, you're placing it in a disinfected mouth, a healthy mouth, and that allows you success in the future.
Okay, so you really have to make sure that your work area is clean and ready before you can fix the root problem.
That's the takeaway message from this whole thing, really.
Yeah,
very
absolutely.
important.
And you guys are experts in that, I know. Dr. Brown, and then I'll ask Dr. McCawley as well. Can you talk a little bit about the procedure in your office? They might be very similar, but what can patients kind of expect before, during, and after, and kind of what's the timeline on that?
Well, routinely, these are placed with local anesthetic. Some patients who are anxious will have sedation of some sort, but most people can have it done with local anesthetic, Novocaine. We numb up the gum. We make the penetration in the bone that we talked about just before. There is no discomfort. We drill to the length of the implant that has to go in, and they're in varying lengths and widths. All that is figured out ahead of time by using a cone beam CAT scan in order to see 3 dimensions of the bone so that we know that it's going to be successful. And then a couple of stitches at the end, and that's it. People can leave the office and go about their business. Almost always that's the case.
Wow, that's incredible. It sounds people hear dental implants and I think they're a little overwhelmed, but to know that it's, general anesthesia and just kind of you can go about your day is that's phenomenal. Dr. McCawley, is there anything you guys do differently or that you'd like to add to kind of your procedure for the dental implants?
I mean, with our dental implants, we have noticed that too. There's a lot less pain with the dental implants, even compared to like a tooth extraction. If you get a tooth out, a lot of times that hurts because there's nerves around the tooth, things like that. But with a dental implant, because there's no nerves and bone, it's a lot less discomfort. People can go about their day. It's not something to be truly terrified about. And again, most people can get by with just having the local anesthesia. But, there are some patients that are more anxious, things like that. And for those patients, we do offer oral and even IV sedation for those patients that need it. Because, you do have patients that have been neglecting, they've been, fearful of the dentist for many, many years. And a lot of times you need a little extra push to help you actually get what you need done. And it's great to be able to offer that to the patients.
Right. Absolutely. What would you say, Dr. Brown, to someone who has been putting off the procedure? Obviously, we talked about how they can be made more comfortable with, sedation, anesthesia, but how can their life improve? Like, what benefits do they get from the procedure that are just beyond the comfort in the chair?
Well, for starters, if it's only one tooth that's missing, they're going to avoid the problem of the space closing and a tooth that's above that space dropping down. So immediately they are stabilizing the dental arch and the teeth are in place. The patient's going to feel the ability, an enhanced ability to chew foods. If there are missing teeth in the front of the mouth, they're going to have an immediate cosmetic positive result. In fact, it's really amazing to watch the look on someone's face when they're revealed for the first time with the teeth that are supported by the implants, which is in the aesthetic zone, as we call it, when a person smiles. It's a remarkable procedure, and it is nothing to be afraid of. And if a patient comes in, we will talk over with them. We do a no charge consultation. The patient will get a CT scan. We'll be able to show them. We literally can put the implants in while they're sitting there on the screen, not in their mouths. And we show them what it's going to look like. And, when you do that, when you've explained it to them and you've shown it to them and they can see it visually, takes away a lot of the anxiety.
Absolutely. And it sounds like the results are more than worth it. I mean, it's life-changing.
It is
incredible.
Indeed.
You guys get to do life-changing work, which is great. Dr. McCawley, tell us a little bit about the teeth in a day procedure and how does this differ from a typical dental implant procedure?
Well, the benefit of the teeth in the day procedure is that we're able to replace a full arch or even a full mouth of teeth in a day. So, it makes sense. So whereas, if you're placing one implant, it's one tooth or, 2 implants, that can be maybe a bridge on 3 teeth. This, we place 6 implants in an arch and we're able to replace all the teeth. Obviously, this is not for everybody, but for someone who's got broken down teeth or they've got very, very severe gum disease where all the teeth have to come out, or maybe they're just in a denture and they don't have any teeth to begin with. So this would be a great procedure for those people. And it's a huge, huge life-changing benefit for them because, to go from not being able to chew, not being able to smile, to being able to chew and smile and actually use regular food. I mean, this is a huge, huge life-changing result for these people. And to have it happen over the course of only a day is incredible. It's absolutely fantastic to be able to do something like that for these people. So that's kind of the teeth in a day procedure. How we've actually modified, because this is actually a modification that me and a local prosthodontist came up with. We actually, instead of using 4 implants per arch, we use 6 implants per arch. So you actually get more support, more stability, and we're using high quality implants too. These aren't, the knockoff implants, nothing like that. So we use very high quality materials, and the final result is even better too, because it's actually made out of porcelain fused to metal, whereas a lot of guys will end up doing it in acrylic, which is it's like a plastic. So if you want plastic teeth, that's fine, but you're going to probably have some breakage. You're going to have some swelling of it, shrinkage, and it's going to actually start breaking down over time. Whereas if you get the porcelain fused to metal prosthesis as a final, it is fantastic. It lasts a very, very long time. It looks natural. It's thin. It's cleansable. Honestly, you shouldn't have it done any other way.
Yeah, it sounds also life-changing. Dr. Brown, do you have anything to add? Do you do anything differently with that procedure, or is that kind of in line with what you do as well?
No, it's very similar to what we do. We have a prosthodontist come into the office. Very often we have a medically trained anesthesiologist come in. And what's really remarkable about this is not the procedure, which is, of course, groundbreaking, but it's the response that people get when they look at these teeth for the first time. Mm-hmm. They're now able to bite into an apple, do corn on the cob, have popcorn, all of those kinds of things that they've been avoiding. The fact that they've been often eating a very high carbohydrate diet because they couldn't chew properly. Those are the gratifications that we get as dentists in seeing these folks leave the office with enormous smiles on their face. So it's a wonderful procedure. And for those people who it's indicated for, it's truly life-changing.
Does it, staying with Dr. Brown for a minute, does it affect kind of whole health as well? Obviously, you said the high carbohydrate diet. So how does that kind of play into systemic health as well?
Yeah, well, there's a tremendous body of literature, and it's in the popular literature, meaning newspapers and magazines, the relationship between periodontal disease and overall health. We know that it affects a plethora of things: diabetes, heart disease. It's even been associated with Alzheimer's disease. So if the patient comes in and they have a really badly infected mouth, and we can remove all the infected teeth that are left, typically there aren't so many left, and we can remove the source of infection, and suddenly the mouth is an altered environment, and it's an environment that favors health rather than disease. So you've actually changed the entire ecosystem, so to speak, of the mouth. And that affects the whole body. I mean, it affects the human being, as we mentioned before, but it certainly affects their systemic or overall general health.
Right. So just more evidence that oral health is just crucial. It should be considered as much as the rest of your healthy routine. Dr. McCawley, what are a few pros and cons to the different procedures like teeth in a day versus typical dental implants?
I mean, again, some of the benefits of the teeth in the day that we provide, because we modified it. We saw the existing procedures out there, like the all-on-4, things like that, and we realized it was deficient. It was deficient in a few ways. it only places 4 implants. That's the minimum amount of implants you can actually support any type of full arch prosthesis with. But if something goes wrong, if you bite down too hard on one of those implants, then it's an all on 4 and a none on 3. So it's beneficial to over-engineer the case, so to speak. So that way, that's why we place the 6 implants as opposed to the 4, to give you more support, more stability. Because remember, you're replacing possibly 12 teeth on the top here. So you want to have the most amount of implants possible to actually support it. Also, another thing was we saw that a lot of guys were making these out of acrylic. A lot of dentists were making them out of acrylic, and that's not a fantastic long-term material. It's a great temporary material, but it's not great long-term because it does tend to actually wear out over time. It'll break, it'll fracture, and it's not strong, and they actually have to make it thicker to give it any sort of strength at all. That thickness makes it very difficult to clean around. And if you can't clean around your implants, then you're more prone to actually getting gum disease, getting periodontitis around those implants. And you want your implants to last you a lifetime. You don't want to have stuff building up underneath, get gum disease, then the implants start failing. I've seen cases like that. It's not good. That's why you want to over-engineer the case, and you want to actually use a material like porcelain fused to metal that's very, very thin, so that you can actually clean around, that you can actually get anything underneath, anything that builds up underneath, you can clean it out really, really easily because it's so thin. And it's also very, very strong. It's much, much stronger than acrylic. It's much, much stronger than a lot of the other materials out there. And it's aesthetic too. That's what you make a lot of the nice veneers and things like that out of. It's a similar material. It's basically the same stuff. So it's going to look nice. It's going to feel nice. It's going to be the most natural, the natural material that you can use to actually replace your teeth with. And that's why we did some of these modifications, because we feel like, honestly, if I were to get that done, that's exactly what I would want, because it's just better. I mean, it should last you longer, and it's going to look nicer for you too, and be a lot better as far as keeping it clean, because we're periodontists first. We want to keep everything clean and make sure you don't have gum disease and don't have periodontitis. And that's kind of how we ensure that our cases last as long as they last. That's our goal.
Yeah, that
the
totally
teeth.
makes sense. Go ahead, Dr. Brown.
Yeah, no, the teeth in a day process is really groundbreaking, and it requires a team. And Mark mentioned the working with a prosthodontist. It's a triad. It's the periodontist who's placing the implants, the prosthodontist who's the dentist who makes the teeth, and the laboratory technician who is skilled at making those teeth look beautiful. And if you can put together that sort of a team, then you are going to be delivering care that virtually nobody else can do. It is very rare that people have that kind of a situation. And I'm proud to say that the two of us both have that ability and have those kinds of specialists backing us up. And we do this regularly. That said, teeth in a day is a small part of what we do with implants. I mean, the average patient who comes in is a single implant. Maybe there are a couple of teeth replaced. We are able to take a patient who the quality, quantity, and volume of their bone is insufficient, and we have procedures in which we can now build the bone up and make the bone acceptable to receive implants. So those are the things that we do the most frequently on a daily basis. The all-on-4 or the teeth in a day idea is fabulous, but it's for a limited number of people and not very frequently. I think Mark would agree that that's not the thing that he does all day long or all week long or all month long.
Yeah, that's true. Because again, we're as I said earlier, we're periodontists first. We want to try to save the teeth. I mean, yes, there are definitely patients out there that their teeth are just too far gone, and they are fantastic candidates for that teeth in a day procedure. But if we can save the teeth, that's going to be our first go-to, because honestly, there's no true replacement for your natural teeth. It's still, the teeth in today is fantastic. It's the best thing out there, but you want to try to save your teeth. And that's why we're able to save a lot of teeth that most dentists, most periodontists even would probably extract. And that's a benefit of using that laser assisted new attachment procedure, using the laser to disinfect, because we're actually able to regenerate bone. Whereas, the old school surgery technique that a lot of guys are still using, you end up actually removing bone. So that's why it's beneficial to actually use a laser, regenerate bone, save the teeth, so you don't have to place an implant, because implants are fantastic. But again, a lot of patients want to save their teeth, and it's great to be able to do that for these patients.
To pick up on that trend that Mark was talking about, what people need to know is that the laser is a minimally invasive way of treating periodontal disease effectively. And what Mark was alluding to is, in the past, we used to treat the effects of the disease. Now we're focusing on the cause of the disease. And the laser allows us to do that in a way that is minimally invasive, lacking in discomfort, and very, very effective in terms of reversing the process of periodontal disease. And by doing that, we're reversing a lot of things medically that may occur to people who have active disease.
Right. So saying that you can't save the teeth, you have to do the implants. I know you guys are big on using the right materials, working with prosthodontists and the correct collaborators, if you will. But how do you keep the implants healthy? What do you do for maintenance? What's the best thing for them to do for that?
Well, one of the things that you need to understand is that implants are not teeth. Mark mentioned that earlier. And teeth themselves are actually more resistant to the bacteria that cause periodontal disease than implants are. So we do a number of things in our practice to make it as easy as possible. If our goal is to get rid of infection, that's what periodontal disease is. It's an infection caused by bacteria. These bacteria can be identified. And if we give them simple techniques for killing the bacteria on a daily basis, in our office, what we do is everybody gets a water irrigating device, a water pick. And the idea behind that is, A, it's easy to use. B, we can put an antimicrobial agent into it, an antiseptic, so to speak. Now when they use the water irrigating device, they're killing the bacteria. They're not just washing away food or whatever is under there. If we can kill the plaque, if we get rid of it, then they're going to stay healthy. Because the fear is that if they get periodontal disease around an implant, it can be devastating. So it isn't enough to replace a tooth with an implant. That patient has to be on a maintenance regimen that's at home and in the professional office, so that we can, in a minute, know whether or not there is active disease. One of the ways we do this is that we take samples of material from around the gum line and we look at it under a microscope. And the McCawleys were also pioneers in this technique. And we've been doing it for probably somewhere between 30 plus years.
Yeah, that's about right. I mean, our office, we did pioneer that. Not me specifically, but my father. He was the one who initially kind of brought that in, and he's all about the bacteria, because again, with these implants, it's important to maintain them too. It's like, you have to change your oil in a car, otherwise it's going to break down. So you have to maintain these implants. You have to keep them clean, and also come in for your follow-ups as well, where we can clean them in office and we can monitor them as well, because there are certain types of bacteria that you do not want to see around your teeth or around your implants. And if you do see that starting to occur, you can intervene before it starts causing damage. And that's really the key right there, because you want to prevent damage as opposed to trying to fix it, because when you fix it, it's not always as good as where it was to begin with. So prevention is worth a pound of cure right there.
Yeah, and we certainly don't want that which caused them to lose their teeth to cause them to lose their implants, because then we're done. Mm-hmm. So it's critically important. It's not like, oh, now you've got the implant that replaced the teeth and see you around. They need to be seen quite regularly. And in most periodontal offices, they have a good hygienist who knows how to teach patients what they need to do at home in order, and it's got to be made easy. And the water pick routine and an electric toothbrush can go a long way if it's taught properly.
Yeah. I mean, that was kind of the prevailing attitude initially when implants came out was they're bulletproof. There's nothing that can ever go wrong with an implant. Well, now we know, 20, 25 years later, we're seeing these implants have issues. And, now we're coming up with treatments, we're coming up with ways to treat them. But again, it's important to be able to catch it early and treat it early before it does get to the point where, maybe the implant may not be savable. So that it's interesting to kind of see the shift in mentality of dentists where, back in the day, they used to say, oh, they're fine. They'll last you forever. You barely have to even brush the thing. Now you have to brush it more. You have to floss it even more than a natural tooth, because like what Dr. Brown said, the attachment is different. You actually get more inflammation, more bone loss around an implant than you would get around a natural tooth. And that's why it's important to follow up and maintain these things.
It's critically important also that the patient be chosen for having implants. In other words, they've got to qualify based on their health history, based upon their dental history. We want to select patients where we're going to have high degree of success. And it's a partnership. It's not something like one and done, see you around, no problem. I think Mark addressed that very, very well. There are people, by the way, who should not have implants. There are people who have certain prevailing problems or medical issues that should be taken into consideration. For one, we need to have quality, quantity, and proper volume of bone. However, if it's not there, we are able to create it often. But people, for instance, who've had a recent heart attack or stroke, or have bleeding issues, or have intractable diabetes that is not controlled, those are all contraindications to dental implants. Also, people, mostly women who have been on the bone strengthening medications such as Fosamax, Boniva, Actonel, and most importantly, if any of them have had it IV, these are the bisphosphonate drugs. That is an absolute contraindication to doing a dental implant. The oral ones, it's possible, but the IV ones can cause great problems. So we have to choose our patients very carefully. And that's the reason why you want somebody who's going to do a thorough overview. Anybody, when I teach my residents, I tell them, anybody can learn to screw an implant in. It's a whole different ballgame to do it right by diagnosis, treatment plan, and execution in a way that is going to be long-term, and the patient's going to be able to maintain the situation. And that's critically important.
Are there any procedures available for those people that cannot have dental implants?
Most of the people who can't have dental implants are in situations in which it's not easy to reverse the process. I mentioned before, uncontrolled diabetes. It's just that any surgery, it's not just implants. So diabetics don't heal very well. So whether you're an orthopedic surgeon or a general surgeon, you're going to be concerned about that patient. Clearly, somebody who's had a recent heart attack or stroke, yes, after they recover from that, it's possible. But most people can have implants. And that's the reason you need to choose somebody who's going to do the diagnosis and treatment planning and be thorough in a way that's not going to put the patient at risk.
Absolutely. And it sounds like you both do a great vetting job of that. Yeah. So, Dr. McCawley, is there anything else you would like to share with the audience about dental implants or teeth in a day, or just any general tips on your mind?
I mean, you want to try to save your teeth. Ideally, that's our first choice. But for those patients who, if the tooth is too far gone, implants are a fantastic replacement. It is honestly the best replacement out there that we have. Until we learn how to grow teeth, which, maybe off in the future, but not just yet. It is the best option to replace the teeth. It is strong. It feels natural and comfortable. It's cleansable around it, unlike a big bulky bridge or something like that. So it's going to be a great replacement. And, it's not something to be scared of. It doesn't really hurt. It's maybe a little bit of discomfort for a day or two, but it's nothing compared to even a tooth extraction. And as Dr. Brown mentioned, it's because of the nerves. There's just no nerves in the bone. So it shouldn't really cause a significant amount of discomfort. So again, don't be afraid. And if you are afraid, we do have IV sedation too. So we can take care of you there. We've had plenty of patients, especially for our teeth in a day procedures, where we do end up, it's a very extensive procedure where we do place a lot of implants. That is fantastic. With the IV sedation, it's like a breeze. You don't remember anything. You wake up at home and you're like, did I miss my procedure? And then you look and you've got teeth. So that's why it's fantastic to be able to do these types of things and to really help these people out, because going from, not being able to chew, not being able to smile to having teeth again it takes years off your appearance. And it just gives you that youthful vigor back, because again, it's like back in the day when you could chew and you could smile. So, smile it up. So come on in and we can take care of you.
Incredible. How about you, Dr. Brown?
Yeah, I was just thinking, in describing this to a patient, they look, feel, and function like a natural tooth. And that's the reason why I would feel comfortable recommending it to anybody. That said, it's important that the person you go to do thorough diagnosis. As Mark mentioned before, you want to rule out periodontal disease. You want to if somebody says, I'm going to take an x-ray and we're going to put an implant in, run. Don't walk for somebody who's going to do a 3-dimensional cone beam reproduction of your jaw, so that we are not going to get into a situation in which something damaging could happen. And there's lots of people out there placing implants, and there's all kinds of courses being given. And tomorrow we can make you an implantologist. Well, you need to do some research and look for the kind of people who have had enormous amount of experience, who teach this stuff to other dentists. That's who you want on your team. And that's who you want to go to. And you want the thorough diagnosis. They have to go through the whole thing in order to keep you safe and ensure success.
Right. Yeah. So it sounds like dental implants, when done with the right practitioner, can really change your life. I mean, you can eat again, you can smile. I mean, it's truly amazing. So if you are in the Philadelphia area or the Fort Lauderdale area and you're interested in dental implants, do not hesitate to reach out to Dr. Brown and Dr. McCawley. We will put their information in the description below, so you can give them a call or visit them online. Thank you so much, Dr. Brown, Dr. McCawley. Clearly, you both have so much experience and expertise, and we are just so lucky to have you here. So thank you for your time, and we hope you have a great day. Thanks.
It's been a pleasure.
Thank you very much. It's always a pleasure to be with Dr. Brown.